Anemia is a common blood condition that affects millions of people worldwide. It happens when your body doesn't have enough healthy red blood cells to carry adequate oxygen to your tissues. These cells are vital because they carry oxygen throughout your body, ensuring that all your organs and tissues function properly. Think of red blood cells like delivery trucks, and oxygen is their precious cargo that needs to be delivered to every part of your body. Without enough trucks, deliveries slow down, and your body systems don't get the oxygen they need to function properly, leading to various health issues. This shortage can make you feel tired and weak, as your muscles and organs are deprived of the oxygen they need to perform efficiently. You might also feel short of breath, especially during physical activity, because your body is working harder to get the oxygen it needs. These are just a few signs of anemia, but there are many other symptoms that can affect your daily life. In the following sections, we'll explore the many ways anemia can manifest in your body and how it can impact your overall health. To understand anemia, we need to talk about hemoglobin. This protein, found inside red blood cells, is the key to oxygen transport. Imagine hemoglobin as tiny magnets within the delivery trucks. These magnets attract oxygen in your lungs and carry it through your bloodstream, delivering it to every cell in your body. When you have anemia, either your red blood cell count is low or your hemoglobin levels are insufficient. This means less oxygen reaches your organs and tissues, leading to various symptoms. Anemia often develops gradually, and you may not notice any symptoms initially, especially if it is mild. This can make it difficult to diagnose early on. As the condition progresses, however, certain signs become more prominent. These symptoms can vary from person to person. Fatigue is one of the most common symptoms. It can be overwhelming and persistent. You might feel constantly tired, even after a good night's sleep. This exhaustion can affect your daily life and productivity. Weakness often accompanies fatigue, making everyday tasks feel more challenging. Simple activities like carrying groceries or climbing stairs can become difficult. Shortness of breath, especially with exertion, is another telltale sign. This occurs because your body is struggling to get enough oxygen. Since your body isn't getting enough oxygen, even simple activities like climbing stairs can leave you gasping for air. This can be particularly noticeable during physical activities. Other common symptoms include pale skin, headaches, dizziness, an irregular heartbeat, and chest pain. These symptoms can be alarming and should not be ignored. Cold hands and feet are also frequent symptoms. This happens because your body is prioritizing blood flow to vital organs. If you notice any of these symptoms, it's important to consult a healthcare professional for proper diagnosis and treatment. Section 4. Unmasking the less common symptoms. While fatigue and shortness of breath are common indicators of anemia, some lesser-known symptoms can also signal the condition. These symptoms might not be as obvious, but are equally important to recognize. For instance, chest pain can occur, especially during physical activity. This pain is often due to the heart working harder to compensate for the lack of oxygen in the blood. This happens because your heart has to work harder to pump enough oxygen-rich blood throughout your body. Over time, this extra effort can lead to more serious cardiovascular issues if not addressed. Frequent infections are another sign, as anemia can weaken your immune system. When your body is low on red blood cells, it struggles to deliver enough oxygen to tissues, including those that support your immune function. Your body may struggle to fight off bacteria and viruses effectively, making you more susceptible to illnesses. This can lead to a cycle of frequent sickness and prolonged recovery times. Other less common symptoms include heart palpitations, a sensation of your heart racing or pounding. These palpitations can be unsettling and may occur even when you're at rest. Some people also experience pulsatile tinnitus, a ringing in the ears that beats in sync with their heartbeat. This can be particularly distracting and may interfere with daily activities. Jaundice, a condition characterized by yellowing of the skin and eyes, can be a sign of hemolytic anemia, a type of anemia where red blood cells are destroyed prematurely. This destruction leads to an excess of bilirubin, causing the yellow tint in the skin and eyes. Recognizing these symptoms early can lead to timely diagnosis and treatment, improving overall health outcomes. Section 5. The importance of seeking medical advice. If you experience any of the symptoms discussed, especially if they persist or worsen, it is crucial to consult your doctor. Anemia can have various underlying causes, from nutritional deficiencies to chronic diseases. Therefore, self-treating is not recommended. Your doctor can perform a simple blood test to diagnose anemia and determine its cause. Once the underlying cause is identified, appropriate treatment can be initiated to restore your red blood cell count and alleviate your symptoms. Remember, early diagnosis and treatment are key to managing anemia effectively and preventing complications.